morning to all. A very pleasant morning to all. Once again, I welcome you all to the second day of webinar on efficacy of yoga and naturopathy on metabolic disorders. I'm here to introduce the first speaker of the day, Dr. B.N. Gangadhar, former director of prestigious Nimhans Institute. Dr. B. Gangadhar is a professor of psychiatry at Nimhans, where he heads the Advanced Center for Yoga. He has served with Nimhans since 1981 and has special interest in somatic therapies, yoga, schizophrenia, and community mental health. He has published more than 200 scientific articles in national and international peer-reviewed journals. He was chief for De-Addiction Center from 2003 to 2006. He serves as co-editor of Acta Psychiatrica Scandinavica and Asian Journal of Psychiatry, and he has received n number of awards, mainly C.V. Raman Award and B.C. Roy Award from Government of Karnataka. He has been principal investigator and co-investigator for many WHO, BST, ICMR, AYUSH, CCRYM and CCRAS funded projects. Now, he is going to take a session on a global-based treatment trends on lifestyle and metabolic disorder in relation to psychiatry. We all are eagerly waiting to hear your words, sir. Over to you, sir.
I'm sharing the slides. I will start with your permission. What I will address today would be how to integrate yoga, spirituality in practice and training with respect to mental health services, psychiatry in particular. Since it is one of the non-communicable disorders, as an example of how to integrate yoga in therapeutic services, I am using psychiatry as a base because I am a psychiatrist myself. There are many slides which are part of this presentation. Some have been borrowed by other authors to whom I have acknowledged in the slide itself. I hope they permit this to happen. And this anyway is a non-profit presentation. I have no other conflicts of interest. I work at the as a professor emeritus in the integrative medicine Nimhans, which is an honorary job. And I also been the president of the Medical Assessment and Rating Board at the National Medical Commission. So I must confess that there are no conflicts of interest in my presentation. We all know that the International Day of Yoga has marked a major milestone in the way in which yoga is put to practice world over. And here we are, we're talking about clinical evidence of yoga in psychiatry, the neurobiological basis of yoga, the relation between yoga and spirituality, although this I would be dwelling on very briefly, scope for integration of yoga in practice and training with respect to psychiatry as an example. I'm sure similar example can be expanded in other fields as well. And then there is a roadmap for integration also I'm going to be sharing with you. There are issues such as the clinical evidence. In this, there are concerns which are listed here I'm going to be talking about. One, of course, which are the conditions where it has been fairly well tested: depressive disorders, schizophrenia, anxiety disorders, and obsessive compulsive disorder, somatoform pain disorders, addiction disorders, childhood disorders in mental health, elderly, and the mild cognitive impairment. There are issues that I'm going to be alluding to, or whether it should be used as monotherapy or adjunct therapy. What is the placebo for yoga trials, blinding in clinical research, in clinical trials, basis why yoga was used, the influence of the school of yoga and the faith related to that on therapeutic outcome, replicability or multi-center trials, and biomarkers and compliance to yoga. Yoga has received a lot of attention in academics. The research in yoga has steeply gone up exponentially in the last 1 decade, as you can see from this graph. And though yoga has been researched extensively, yoga therapy itself has also gone up very steeply in the first 5 years of the last decade, whereas in the second half, it has some form plateaued. It calls for more energetic way in which we look at the yoga applications and research in yoga therapy in particular. Let me go quickly to the clinical evidences of yoga. The standard way in which the clinical evidence is tested is clinical trials, but a robust data that comes in clinical efficacy trials would be the what we call as the meta-analysis, whereby multiple studies of similar nature are looked at and a pooled data testing the effect size of the difference. Here, effect size of difference with respect to yoga in psychiatric disorders in general seems very promising, close to 0.5, which is clinically fairly respectable. Overall, yoga helps. In depression, yoga is again in a meta-analysis found yoga is better than treatment as usual. Yoga is better than relaxation. Yoga is better than aerobic exercises. So yoga is has a role in depression. We also looked at yoga, although I want you to appreciate that this is not a clinical trial. It's not a randomized clinical trial. But when yoga was given as the sole treatment in outpatients reaching a psychiatric hospital for treatment for depression, substantial reduction of depressive scores happened. The graph which is interrupted, the lower one. In fact, yoga brought the lowest, although I am cautioning, please don't interpret it as a comparative trial. It is just data of a patient selected yoga application and the outcome over the course of 4 weeks of yoga. 3 months of yoga. The guidelines of, having seen the evidence, there are some professional bodies which have made guidelines of yoga for use of yoga in depression. The Canadian guidelines, for example, includes yoga application in mild to moderate major depressive disorder. There is sufficient evidence. They recommend that it should be used as a first or second line of treatment as an adjunctive one. Adjunctive at this point of time in one of the guidelines. Yoga has been examined in anxiety disorders as well. There is, again, although not as robust as it was in depression, there is evidence that yoga benefits patients with anxiety disorders. Yoga has been put to use in one of the variants of anxiety disorders, although not the anxiety disorder itself, post-traumatic stress disorder. Again, yoga is beneficial over no treatment, or yoga is beneficial to one of the methods that is used in PTSD, attention control disorder. Yoga significantly is better than no treatment, and it should be used in post-traumatic stress disorder. Obsessive compulsive disorder is another variant. Of course, now it is subsumed under a different category in the international nomenclature, but nonetheless, earlier it used to be grouped under anxiety disorders. Yoga, the blue line, brings down obsessive compulsive score substantially compared to the waitlisted group. This is again outpatient group of obsessive compulsive disorders, a study that was recently conducted and yet to be published. Schizophrenia is another condition which is a serious condition, low prevalence disorder, but nonetheless the burden of psychiatric disorders, amongst which schizophrenia ranks number 2 perhaps. Schizophrenia and yoga, we have seen that yoga, when introduced in stabilized outpatient schizophrenic individuals, more individuals lose their negative syndrome, and also total scores of the psychiatric rating, more people lose this. The blue bars indicate the numbers of people, almost a third of them lose this symptom, or at least reduce the symptoms of the negative and the total scores of the one of the ratings. So this is a 4-month clinical trial, again randomized into yoga, exercise, and a waitlist group. In schizophrenia, we have one symptom called as the cognitive domain social cognition deficit. Social cognition deficits are substantial in schizophrenia and they don't respond to conventional treatments. In outpatients, when yoga is given or patients were waitlisted, yoga produced a substantial improvement in the social cognition scores, as you can see in this graph, the blue pre-treatment and the white post-treatment. Yoga versus the same period of waitlisted period, no change happened, but on yoga, there's a substantial improvement in the scores of the social cognition rating. As a consequence, perhaps more people who received yoga obtain improvement with respect to social functioning. There is a measure of social functioning that is possible with patients of schizophrenia, and it shows change. And more people who are given yoga obtain improvements in social functioning in schizophrenia. And as a result of these data that has been generated in clinical trials, one of the international guidelines, the National Institute for Health and Healthcare and Excellence, included yoga for psychotic disorders as an adjunct when antipsychotic drugs are continued to be given to these people. We also have tested yoga in opiate disorders. I'm not going into those scores here, but yoga produced substantial reduction in several ratings of the substance use disorder patients, opiate abuse in particular. There was an improvement. This is an open trial, but I must confess that we have published a single case study. We developed a validated module of yoga in opiate use disorders. We tested a tele-feasibility thanks to COVID, during which time we were able to put it into use, and good number of people adhere to treatment. 73% of them adhere to treatment, and there was a significant reduction in clinical global impression in these patients who practiced yoga. So this is an open trial, and the limitations I'm sure all of you will appreciate. Yoga was also tested in somatoform pain disorder, where we found that there is a substantial reduction in the pain scores of people. These are all somatoform pain disorder is a condition wherein pain occurs when there is no foundation or basis from a physical disease. Yoga has been applied to autism, a childhood condition. Some people consider as a developmental disorder as well. And autistic children obtain benefits with yoga. Many symptoms of autism get better with yoga being practiced. This is a randomized clinical trial, and the evidences are quite reassuring. Yoga has been put to use in elderly individuals to benefit their mild cognitive impairment symptoms, cognition. Both memory and non-memory cognitive functioning improves following applications of yoga. Their sleep also improves. We have another data where yoga produced, actually not produced, when yoga was withdrawn, the steepest fall in symptoms happened. This was a study that was done in a elderly care home in a rehabilitation program. So the yoga produced the greatest damage, or let's say reduction in scores when it was withdrawn as compared to other inputs that were being put, indirectly suggesting that yoga was benefiting the cognitive or symptoms related to dementias. Now, having said that there is a clinical evidence, do we have evidence with respect to any neurobiological markers? We looked at cortisol, limbic activity, physiological limbic activity, GABAergic transmission, brain-derived neurotropic factor, BDNF role, the neuroprotection with the yoga, concept of slowing senescence, neurosenescence in particular, increasing oxytocin levels, improving brain connectivity, and establishing sympathovagal balance on the heart. So multiple things have been looked at, and the list is perhaps growing by day, and our colleagues at NIMHANS and many other centers are examining neurobiological evidence for markers of yoga in other psychiatric and non-psychiatric conditions as well. In depression, levels of cortisol are high, and in turn, they actually cause brain damage as well. More people who received yoga, either with medicine or without medicine, obtained almost 2/3 of them were able to have their cortisol levels reduced following the intervention of yoga, whether they took medicines or no medicines. Medicine alone, that change was not as evident. Again, caution, this was not a randomized clinical trial. In patients with alcohol withdrawal state, while they were undergoing treatment in the hospital, alcohol withdrawal is a stress and cortisol levels will be elevated. You treat the condition, cortisol levels drop. You add yoga in the 2-week period and compare it with a group where yoga was not added, treatment as usual happened. We have another data where yoga addition brought down cortisol levels more steeply than when yoga was not being added to these groups of people. More interestingly, the degree to which the cortisol levels dropped was related to the degree to which their depressive symptoms got better. In fact, during the withdrawal state, they experienced dysphoric mood state, and this was measured, and the degree to which yoga produced cortisol reduction, it also produced similar reduction in depressive symptoms. And how does yoga mediate this effect? Cortisol is a stress hormone, and stress is mediated by our limbic structures, which are emotional centers. And limbic activation causes heightened emotionality and heightened stress responses. And these limbic centers are actually deactivated when one of the components of yoga is practiced, Om chanting. In fact, Om chanting is a common component of most yoga packages. When you chant Om, the limbic structures are deactivated. So it is possible that the stress reduction mechanism could be mediated through this process. Although I must confess that this data was from healthy subjects. Similar data has been there on heart rate variability, about which I'll come to a little later. Yoga also produces reductions in or increases in one of the neurotransmitter, which is an inhibitory neurotransmitter, gamma aminobutyric acid. This is now measurable. The increases of the GABA function are measurable by a neurophysiological test, measuring a variable called as cortical silent period. Although the measurement is in the electromyogram, for sake of understanding the neuromuscular transmission effects, it is a centrally mediated silence in the brain, which is reflected in the silence of the EMG here. So I'm not going to the way in which how we do it, but suffice to say that yoga caused lengthening of the cortical silent period, suggesting the increase of GABAergic function in healthy subjects. And what did we do while we translated it to patients? In depressed subjects, the blue on the left side and the purple on the right side. The blue on the left side and the yellow on the second graph. It shows that depressed individuals have a shorter cortical silent period, which compared to healthy subjects. And these depressed subjects were randomized into either walking or yoga. This is for a period of only 1 week. The examination was done. And in this 1 week period, walking subjects produced no change in the cortical silent period. It remained where it was. Whereas in that 1 week, the yoga group started inching towards the values of normal, getting the cortical silent period longer. Though both groups of people obtained some unsubstantial and clinically significant reduction or improvements in the depression score. So the message is that the physical activity improves depression, may not correct a biological dysfunction, whereas yoga improves depression as well, and also in quotes starts to correct the biological substrate for this depression. This has been published a couple of years ago in one of the international journals. Elsewhere, people have been able to demonstrate that directly measuring GABA levels, that is now possible by way of magnetic resonance spectroscopy, that the levels of GABA are elevated in the thalamus following yoga. And this is also related to the reduction in depression that these people obtain following yoga. The cortisol is reduced, mediated through the brain mechanisms of limbic system, and that in turn is measurable by way of reductions or increases in the neuroinhibitory transmitter called as the GABA, and the GABA levels get to better, or GABA function gets better in depressive subjects following yoga. And as a result of that, of this cycle of events, it is possible to believe that the brain-derived neurotropic factor is also affected by practice of yoga and depression as well. I'm not bothering you about the way in which you are going to interpret the graph here. Suffice to say, the take-home message is, in depressed subjects, the brain-derived neurotropic factor is lower. Brain-derived neurotropic factor actually becomes values of a normal following the treatment. And even in depressed subjects, between when they were depressed and when they got better, brain-derived neurotropic factor continued to have an elevation. This is the summary of results available from studies elsewhere, and we were able to replicate it in the outpatient depressives. Depressives, when they were given treatment, medicines, yoga, or both, they obtain a small increment but significant increment in the brain-derived neurotropic factor. The blue and the red bars indicate pre and post data. And the blue bar, next one, is the healthy subjects' values, suggesting that in depressed individuals, brain-derived neurotropic factor are lower, and given treatment, they start getting these values better, closer to that of the healthy subjects. And when you look at this data with yoga alone or yoga with medicines, again, the yoga effect is seen quite significantly. Yoga alone also improves the levels of brain-derived neurotropic factor. So, having said this, this work we replicated in a different animal model study, in a different in vitro study, but we were able to replicate, firstly, that in depressed subjects, increases in BDNF happens. More interestingly, the peripheral blood mononuclear cells in this group of people were taken out, and they were put to a stress test by application of lipopolysaccharide. So before lipopolysaccharide stimulation, in yoga therapy group, no change happened. The pre and post BDNF levels were similar. In the yoga therapy individuals, when you add a lipopolysaccharide, there is a stress response to which a protective BDNF release will have to occur. Before yoga therapy, that this did not happen, but following yoga therapy post, there was a substantial increase in the BDNF levels, indicating in an indirect way, body has developed resilience to stress by way of producing, when under stress, increased levels of BDNF. So depression is a stress, and BDNF level are likely to be lower, which was demonstrated earlier. Yoga produced increases in BDNF level as a stress response. Also, yoga making the body be prepared for the response to the stress. Like I said, stress is again mediated by cortisol, and cortisol reduction happens with yoga. People who obtained reductions in cortisol obtained the best increases in the BDNF levels. So stress are related to the brain-derived neurotrophic factor, which is a protective chemical, make sure that wear and tear of the brain is protected. And in depression, more wear and tear will happen because we are continuously stressed. Yoga improves the stress response, reduces cortisol, and in turn increases the BDNF, and so is conducive to produce or protect the brain. In fact, we know that in depressed individuals, the red areas are indicators, areas where there is a loss of gray matter in chronically depressed individuals. Chita dahati nirjeevam, chinta dahati jeevanam. When you are continuously stressed and you are worried, you are likely to have effects of stress which reflect on the brain, which is not getting continuously repaired, and so the gray matter is going to be lost. So that's the reason why our ancestors said, Chita dahati nirjeevam, chinta dahati jeevanam. When you are continuously worried, even when you're alive, you're going to be losing some parts of your body, the brain's gray matter, for example. So people elsewhere looked at a neurophysiological marker on heart rate, which again mind-body interventions, Tai Chi or, for example, yoga, produced increases in heart rate variability, in suggesting parasympathetic dominance, which is conducive to protect the heart as well while under stress. So under stress, sympathetic increases would happen, but because you have practiced yoga, heightened parasympathetic activity on the heart is retained, and so the individuals continue to obtain higher heart rate variability. So having said these things, we also have oxytocin responses in following yoga. In schizophrenia, low oxytocin. So how does oxytocin come into picture? Because it is a cuddling hormone. It makes you feel good, this hormone. And in schizophrenia, this hormone is lower. And so they have a very poor social cognition and social functioning. And their emotional responses are also quite cold. And you give yoga, the levels of oxytocin increase, and in the individuals obtain clinical benefits in social functioning and also in the negative symptoms which are there in chronically ill schizophrenia subjects. So one of the mediators in depression is anti-stress response. In schizophrenia, it could be mediated through the increases in the levels of oxytocin. And so the individual becomes more as a process of these interventions, the brain also starts to get better. Like I said, we demonstrated it could protect the brain's structure, protecting the loss of chinta dahati jeevanam. It is protected. Likewise, brain repair can also happen by way of improving connectivity within the brain. In schizophrenia, this connectivity is poor compared to healthy subjects. Schizophrenia subjects have a poorer connectivity across some of the networks of the brain. One of the networks that is commonly studied is the default mode network, which is there both in the front and in the back of our brain. This default mode network is poorly connected in schizophrenia subjects, as you can see here, vis-a-vis healthy subjects where connection is seen, both the red and actually the yellow is a better connection. So this has been now possible by way of functional magnetic resonance spectroscopy. And we also looked at this connectivity in schizophrenia individuals who have a poor connectivity. When you give yoga, before and after yoga, this individual subject produced improved connectivity. The coherence in these two networks, anterior and posterior networks, went on to get brighter. That means the coherence got better following yoga. And of course, this group of people also obtained reductions in their negative symptom, and the degree to which the coherence improved was related to the degree to which the negative symptoms dropped. So suggesting that brain mechanisms are inherent parts of the yoga mechanisms producing therapeutic benefits. All these things perhaps add to the brain's protection, which we indirectly were able to demonstrate in elderly individuals who practice yoga for 6 months, staying in elderly homes. The area we measured was the hippocampus, which can be seen here as an yellow spot here. This is the hippocampus. Hippocampus shrinks with age. And in fact, that is the first area, first region where we start losing the gray matter. After older age, elderly subjects will lose it even faster. For example, my hippocampal will be smaller than an individual who could be 20 or 30 years old. Nonetheless, I practice yoga, the hippocampal gray matter measurements actually get bigger. This is a voxel-based morphometry, although we don't have a structural data to actually measure this hippocampal gray matter itself, but we use the indirectly neuroimaging method to calculate the gray matter in the hippocampal area. Elderly subjects, 6 months of practice of yoga, obtain increases in the gray matter of the hippocampus. There are serious limitations of this observation. There is no comparative data of no treatment. So that is the limitation. But nonetheless, this is a preliminary data to say that yoga has a neuroprotective effect in a prospective design. This has also been replicated by another study. Unfortunately, I couldn't add it in these slides at this point of time. Yoga has been cross-sectionally examined with respect to this neuroprotective effect. People who were chronically practicing yoga, vis-a-vis people who were not practicing yoga. Those who are not practicing yoga, albeit they are healthy, age-dependent loss of gray matter, the interrupted lines. With older age, they have lesser gray matter in their brain. This happens in most healthy individuals who otherwise are not practicing yoga. You add yoga practice as a part of healthy or healthier lifestyle, they perhaps retain the gray matter better. Yoga practitioners, this age-dependent loss of gray matter is not manifest. And this, not only the brain, rest of the body also perhaps retains the youth when yoga is practiced. You give yoga and a control group, one of the measures of this youth in the body is the what we call as the telomere. Telomere is a part of the chromosome which tends to get shorter as the body gets older and older. And this shortening is prevented if yoga is practiced, and this effect may be mediated through the what we may call as the potentiation of antioxidant status in subjects who are practicing yoga. Antioxidant status actually protects the shortening of the telomere. In turn, this is related to retaining one's youth, whatever may be the definition of youth. So not only the brain, senescence in the rest of the body is also retained by practice of yoga. I not going to go into details of yoga and spirituality, but a small note that Ayurveda had defined health as just not only body and mind and social, as we define in the WHO definition of healthy or health. It also included prasanna atmendriya manaha. Manaha, of course, is body and mind, but it also spoke about spiritual health. The concept of spiritual health is a different agenda altogether. I'm not going into go into these things, but nonetheless, yoga benefits the spiritual health as well. And people say that I continue to practice yoga, I start connecting my consciousness to the bigger cosmic consciousness, and I, of course, as a part of the process of yoga sadhana, I start connecting into neighbor ones, and I feel well connected with people. I feel a growing compassion. I feel confident. These experiences we have seen yoga practice people talk about. So yoga could be bringing out this benefit through a spiritual process, health of individual, improving the spiritual health could be augmented. And in fact, one of the studies found that benefits in depression could be because of a feeling of connectedness that was produced by yoga intervention in depressed women who had a diagnosis of major depression. So it looks like this yoga, of course, huge means to connect. When I'm connecting to the cosmic consciousness, somewhere I should also start feeling connected to this people in the worldly group. Vasudhaiva Kutumbakam should happen. We are all connected and all we feel as one family should happen, let alone we growing or transcending into that spiritual connection with that cosmic energy. Leave that apart, that a spiritual change that is happening with yoga, and yoga is the toolkit for improving spirituality. So in effect, spiritual lifestyle means moving from curing illness to promoting wellness, getting over my mental turmoil, yoga, chitta nirodha, which we have been speaking about. And yoga is a self-empowering spiritual tool, which is secular, and to make our health even better once you continue to practice yoga. So, which means yoga has to be integrated in clinical practice, clinical psychiatry in particular. So we have now should start writing chapters, writing books about indications, diagnostic indications, symptomatic indications of yoga, whether you're going to use it as first line therapy or as a second line therapy. Some guidelines have already indicated it as both first and second line, but with addition of treatment to ongoing medicines. Although some trials have started to indicate that in some conditions, yoga as a monotherapy also could benefit the individual. Standards for yoga practices have been now developed, and how to accredit therapists who have to apply these standards of standardized yoga practices is some issue that all yoga schools should talk about. Contraindications about who are the people who should not do it, or which of the procedures which should not be given to which individual. These medical way of applying yoga probably is emerging, and people are already talking about it. Although we say yoga has no side effects, some side effects have to be recognized in some individuals, particularly when they practice some of the intensive postures or intensive breathing exercises or breathing pranayama or kriyas. At that time, we have to keep in mind whether any individual should actually avoid or do less of it, etc., etc. And who should deliver yoga therapy? As I already said, how do you accredit individuals to be doing it? Insurance and liabilities of yoga clinical applications is another area where we have to perhaps come out with some documents. As some initial steps, we talked about generic modules of yoga for conditions. These are all generic modules. When I say it does not relate to any one school, but they are open like generic prescriptions The descriptions of the yoga module are given. Everyone is free to use it. Generic yoga modules have been published for depression, schizophrenia, mild cognitive impairment, ADHD in children, alcoholism, like I said, substance use disorders, opiate dependence, obsessive compulsive disorders, migraine, anxiety disorders, somatoform pain disorders. These publications have come and more are getting added day by day. And when to refer a patient and what are the challenges in referral of these patients. Like I mentioned, contraindications, the do's and don'ts while practicing yoga, any specific form of yoga, or it could be done as a generic module as we described, need to be discussed. Can you learn it from qualified teachers, and what is their qualification, what is their accreditation, what is their registration, an issue that need to be discussed. And I'm sure those are all parts of integration that we need to develop. Is yoga practicable as a tele-yoga in therapy? Yes, there is some lead that it is doable, and there is some benefit in tele-yoga as well. What about meditation? This question is often asked. I generally say that yoga is itself meditation. A mindful practice of the postures and pranayama could be a part of the meditation process itself. Although exclusive meditation is something that we, at this point of time, are refraining from recommending it to individuals who are psychiatrically disturbed. We know that standard training in yoga learning, yoga sadhana, is you have to keep your mind calm before you start your meditation. So through your body, you calm your mind and then go on to do the meditation to get further spiritual transcendence. Some clinical trials have already happened, whether yoga should be given thrice a week and twice a week. And they found that thrice a week produced faster. Although statistically we did not find a difference, the graphs indicate that using it thrice weekly was perhaps better than using it just twice weekly. It reminds me of one of the clinical trials that I did when I was using ECT as a treatment, which given twice and thrice weekly, there were no differences. I am not going into that comparison between ECT and yoga though, but just remembered a similar study that I had done long ago. And this study was done by another group of people who compared twice a week yoga versus thrice a week yoga. So put together, we have to integrate yoga into clinical practice. The integrative medicine department of NIMHANS was able to do this, and I'm giving some tips as to how it went on. Yoga was first put to clinical practice. Yoga had been there in the research department of physiology, thanks to the Department of Physiology, which enthused some of the clinicians like us. We started putting yoga into clinical practice. So that is the first step of integration, and getting to know about yoga, getting to know where it works, diagnostic, and which symptoms it gets better. All these issues about mono or adjunct therapy, contraindications, motivating clinicians and motivating patients who have psychiatric illness, their motivation could be compromised, and how yoga therapists should become a member of the mental health team, like the psychiatric social workers or clinical psychologists. These things were standardized in NIMHANS. And we also gave training on principles of yoga, applications of yoga in therapy. We did a yoga appreciation course to all clinicians, both nurses and other clinicians in psychiatric practice, so that they became aware that yoga could be applied to psychiatric disorders, started referring yoga, and the concept of yoga psychology was also expanded to learn, for example, the Panchakosha theory of yoga practice. And there are some similarities to the modern day psychologists teaching of the Maslow's principles. Seminars were conducted to understand and appreciate yoga applications, albeit yoga being a older treatment, a traditional treatment. It has evolved very systematically. It has had a base on strong psychological and clinical foundations. And these messages were made to be reached to our colleagues. And as a result, yoga, being a non-invasive tradition, became very popular in psychiatric practice. This is an example of how different kosha theories have some parallels to the Maslow's pyramid, from physiological needs to transcendence. Uh, Suffice to say that yoga has had a strong psychological foundation. And of course, with the advent of modern technology, we are also able to demonstrate it has a strong biological foundation as well in therapeutic applications in psychiatry. So in summary, yoga benefits mental disorders. Standardization of yoga has been in progress and it continues to get better. There are biological markers of yoga that are emerging. Yoga and spirituality have some common things, both philosophically and biologically. Training to mental health professionals to appreciate, refer, and even practice yoga is possible. We were able to conduct a World Psychiatric Association collaborated training of psychiatric and mental health professionals on appreciating and be able to identify when to refer patients for yoga therapy. A course was successfully done, and as many as about 80 people participated in this WPA course on yoga therapy in psychiatric disorders. Need to have a yoga therapist in a team is now beginning to be appreciated, and it could well happen. Developing curriculum and training and advanced research with respect to yoga and mental health has now been possible. Together, integration of yoga is a possibility, and I think we should hasten the process to ensure that most clinicians start embracing yoga as a part of their clinical armamentarium. With this, I stop my talk. My prayers and pranams to Mata Saraswati, whose blessings made me prepare all this material for sharing with your colleagues, and also the place of work which generated all this data for me in the past and even now is the Yoga Center or the Department of Integrative Medicine at NIMHANS. I thank all of you, and I also thank many of my colleagues who work there to help me prepare these slides and prepare data and add data to this presentation. Once again, if there are any questions, if you can't raise it in this forum, go ahead and send these questions on this email address. Whatever I can, I will surely answer. I thank the SDM group, particularly Dr. Prashant and team, for inviting me to give this lecture on this very, very auspicious day and also very important day when you are conducting an international conference in yoga. I wish all the participants and all the team members at the SDM and the colleagues of Dr. Prashant and co a very, very happy the lunar new year that's going to happen on Friday onwards. I wish you all the best for a new year beginning on Friday. Dhanyavada.
Questions from the audience. How does heavy blow on the head lead to neurodegenerative diseases? How does heavy blow on the head lead to neurodegenerative disorders?
Say it again, madam. Neurodegenerative disorders, is yoga useful? Is that right?
How does heavy blow on the head lead to neurodegenerative disorders?
Yoga has the potential for use in neurodegenerative disorders. There is a circumstantial data that I have produced in this presentation, improvement in brain-derived neurotropic factors, and also some protection to neurosenescence. Both should have the potential to use yoga in neurodegenerative disorders. While more study is required, there are some studies which are emerging using yoga in Alzheimer's disease, mild Alzheimer's disease, although this data is still very incomplete.
Okay, thank you, sir. The next question being whether reduction in GABA levels cause Parkinson.
So here, what we demonstrated here is yoga produces increases in GABA levels and GABA transmission. GABA has been implicated in many psychiatric and neurological disorders. Stress reduces GABA. Reductions in GABA produce anxiety and depression. Reductions in GABA further could potentially produce seizures, and any GABAergic medicines control seizures, improve anxiety, improve depression, increase sleep, and also reduce stress. Instead of using medicines for this GABAergic effect, yoga could well be a GABAergic intervention.
All right. Can reduction in gray matter or white matter lead to epilepsy?
Right now, my knowledge on epilepsy is very limited, madam. So there are studies done on yoga in epilepsy. I would perhaps refrain from answering this, as I may not be the most competent person in this area.
Okay. The last one, what are the main interventions done on autistic children?
There are many interventions that are done on autistic children. Yoga is one of the non-pharmacological interventions that are done. The yoga intervention, we know yoga intervention. Some of the benefits were seen in yoga intervention, mimicking, following gestures, etc. Eye contact getting better. In fact, in uh, infants, oxytocin nebulization produced better eye contact, better social contact, better mimicking the actions. So these suggest that again oxytocin elevation could be a mechanism by which yoga improves individuals with autism also.
Thank you, sir. Thank you so much.
So if you permit, I can exit from the screen.
Sure, sir. Thank you.
Okay, madam. Thank you so much.
Hello, everybody. Thank you very much for having me. Today, we are going to talk on a very interesting topic. What role does yoga play in hypertension? This is very interesting because, as you know, millions of people all over the world suffer from hypertension or high blood pressure. So, let's take through this journey and Hello, everybody. Thank you very much for having me. Today, we are going to talk on a very interesting topic. What role does yoga play in hypertension? This is very interesting because, as you know, millions of people all over the world suffer from hypertension or high blood pressure. So, let's take through this journey and find out what does the latest research say. In the last 10, 15 years, there's been hundreds of research on the effects of yoga, meditation, mindfulness on blood pressure. How does human blood pressure gets controlled? What are the factors that affect human blood pressure? Once we know that, once we know the pathophysiology, we'll slowly come to know why yoga is extremely powerful mechanism which can be used to control your blood pressure or anybody's blood pressure and should actually be part and parcel of medical therapy along with medicine and other measures to completely treat cases of high blood pressure or hypertension. The objective of today's talk is to understand the basis of hypertension, to understand the pathogenesis of hypertension, and also to have an idea of the latest research, medical research on the use of yoga in hypertension. So, hypertension is something where we have a systolic blood pressure above a particular amount and diastolic blood pressure above something. So, a systolic blood pressure equal to above 140 and a diastolic blood pressure above 90 defines hypertension. Now, there are different stages of hypertension. This is based on the 7th Joint National Committee. We also have the 8th Joint National Committee. To make it very simple, I have purposely used the results of the 7th National Committee. So based on that, blood pressure can be normal, which is when the systolic is lower than 120 and the diastolic is lower than 80. Then you have pre-hypertension, then you have stage 1 hypertension, and then finally you have stage 2 hypertension. I will not go through each of the details. They're all up in your screen so that you can learn what are the criteria that JNC uses to classify different level of seriousness of high blood pressure or hypertension. Now, hypertension is classified in two ways. You have primary hypertension, which is the most commonest form of hypertension, and it is found in 90 to 95% of the people. And then the minority has what is known as secondary hypertension. So, what is primary hypertension? As I said, this is the predominant type of hypertension. It is basically caused by genetic factors, by lifestyle factors, abnormal lifestyle, eating a lot of salt, increased body weight, that's obesity, smoking, random alcohol use. So most of these are blood pressure where actual cause is sort of unknown, which basically means that the cause is not one single. It is a combination of genetic, what you have got from your parents, from your grandparents, that is hereditary. Combined with that are environmental factors, predominantly among which are psychosomatic factors, including if you're having depression, your chance of getting blood pressure is more, chance of having complication of blood pressure is more, as well as lifestyle factors, that is inappropriate diet, lack of any exercise, obesity, so on and so forth. Now, the remaining 5 or 10% cases are categorized as secondary high blood pressure. These are high blood pressure where there's a definite cause. For example, you might have chronic kidney disease. You might have narrowing of blood vessels in the kidneys. Or you might have some endocrine diseases where you release a lot of corticosteroids or other hormones, which increases your blood pressure. But this is generally extremely rare. It's found more in younger population, sometimes even in their teens or before their teens. And it's easily correctable because, for example, if you have a small artery or constriction of arteries supporting blood to your kidneys, then you can go and open up those blood vessels using stenting or angioplasty, and that blood pressure goes on. If you have a genetic disease where there is a mismatch in handling certain compounds like sodium or potassium by medication, those can also be treated. So, for general understanding, primary hypertension is the commonest form of hypertension. Secondary hypertension are those hypertension where there is a detectable cause, which, if treatable, cures that hypertension. But if it's not treatable, obviously, then you need to treat it for a long time, or you might be able to control it but not cure it. Now, according to World Health Organization, adults, almost 40% of adults living on planet Earth has high blood pressure. That's a massive number. It's not in tens, it's not in hundreds, it's not in thousands, neither is it in 10,000 or millions. It's huge number in billions. So, given the big problem, it's a problem that transcends every nation, every culture, every race, every creed, and every color. So it is such a big problem that it is important that we know how to treat it and treat it appropriately at the least cost, at the same time making sure that we don't end up creating complication, which is very common with having high blood pressure that is untreated for a long time. If you look at a pooled analysis of 1479 population patient from over 200 countries, it showed that in 1975 you had almost 600 million people with high blood pressure. That went to over a billion in 2015. And now it is almost twice that number, though we don't have the exact number, because there has been a massive increase in the number of hypertension because of different reasons. And one of the reasons is also the fact that the planet Earth has more aging population, which also renders increased risk of creating hypertension. And it's also understandable, it's also important to understandable that a large number of increase of this increased number of hypertension is relegated mostly to low and middle income countries. And we shall talk about that a little more. But if somebody is, poverty itself is a risk factor. So socioeconomic downturn is itself a risk factor for hypertension due to many reasons, including the fact that it increases stress, which itself is a big cause for hypertension. Now, complications of hypertension resulted for over 10 million deaths every year. And hypertension is in fact responsible for 45% of death due to heart disease, like heart attack, heart failure, and 50% of death due to stroke. So half the people dying because of stroke is due to high blood pressure. And almost half the patient who die due to heart attack, heart failure is directly related to high blood pressure. So it's important to understand that though a silent disease by itself, hypertension can actually be disastrous. Why? When arterial hypertension is not well controlled, it can cause severe pathologies like heart attack, that is called myocardial infarction, thickening of the ventricle, that is ventricular hypertrophy, which itself can give rise to dangerous other arrhythmias, including what is known as sudden cardiac death, where a person dies suddenly because his ventricle or the main heart, the main chamber of the heart, goes into dangerous rhythms. And certainly heart failure, and there is expectedly around 22 million people with heart failure the world over. And one of the direct consequences of blood pressure being high, not appropriately controlled, not well managed, is heart failure. And it is important to understand here that the sound heart failure does not seem as bad as a cancer, but in fact, it is not known to many people that heart failure can actually be even more deadlier and cause death than most cancer, except probably a couple of gastric, pancreatic, and a few other cancers. So, though it doesn't sound that ominous, heart failure is a really dangerous disease, and hypertension is directly responsible for creating or producing heart failure in a large majority of patients. But there are other consequences also which we need to do. It can cause bleeding inside the brain by causing aneurysm. It can cause blockage or rupture of blood vessels, which can, if it happens in the brain, you get dementia. If it happens in the heart, you get a massive heart attack, which can even kill people. And of course, uncontrolled blood pressure for a long time can cause kidney failure, blindness, and also cognitive impairment. So, blood pressure, unfortunately, is one disease, though it affects only the arterial system, but in fact, it's a systemic disease from the tip of the head to the tip of the big toe. Every organ in the body can actually be affected with disastrous result. Now, what are the risk factors for hypertension? There are multiple risk factors, but they are basically clumped into three basic. One is behavioral risk factors, number two is metabolic risk factors, and the third is socioeconomic. We'll try to concentrate here mostly into the behavioral and the metabolic consequences, and I'll just mention socioeconomic um, uh, to only one point. Most people who have high blood pressure belong to middle or low economic strata, because low economic strata itself is a risk factor for hypertension. And we'll talk a little more when we talk about other factors, but it's important to understand that low economic status, poverty, is a direct risk factors for high blood pressure. Now, behavioral factors are factors that can actually be changed. It depends directly on the people to change these habits so that they don't have hypertension. What are they? They are like food containing too much salt and too much fat, not having enough fruit and vegetables in your diet, lots of alcohol consumption, smoking, sedentary lifestyle, which means you're a couch potato. You sit and watch TV the whole day, no exercises, no physical activity. And what is last but not the least and extremely important, as we shall see throughout this talk, is poor stress management, because stress is inevitable while staying on this earth because of different reasons. Just now, for the last couple of years we had COVID. So stress is inevitable, but how you manage stress, that depends on you. And by appropriate management of stress, it is absolutely possible to completely negate the bad effects of stress. And we shall talk much, much more about this as we continue forward. Metabolic factors are obesity, cholesterol, having high cholesterol, having diabetes mellitus. And I talked about socioeconomic factors also, poverty, lack of education, lack of housing. All these are factors that increase the risk of all these are risk factors for arterial hypertension or increased blood pressure. This is the the general pathophysiological mechanism. I don't want to go into the details, but this is there for you to see. Essentially, you have genetic influences, environmental factors, and here what we mean by environmental factors is all the bad habits, lifestyle factors that we spoke about till now: lack of exercise, obesity, having food, lot of salt and lot of fat. All these cause three different things. It can result in functional vasoconstriction, decreasing vascular reactivity. It can cause problem in the smooth muscle growth and structure that lines the blood vessel. All these increases total peripheral resistance and causes hypertension. On the other hand, genetic factors like defects in renal sodium homeostasis or inadequate sodium excretion can cause increase in cardiac output, problems in autoregulation leading to hypertension. But other than genetic influences, even environmental influences play a big role in this, because though the genetic problem is the root of the cause, but adding to the root of the cause, inappropriate lifestyle measures like eating a lot of salt with your food will make all these things worse. So it is important to understand that it is the whole group of things together that finally results in the disease and continued progression of the disease unless we take appropriate steps and try to negate each and every of these factors that are responsible for hypertension. What we don't understand for thousands of years, or we have not understood for thousands of years, is now clear in the last 20 to 30 years because we have now the capacity to get inside the brain and understand the brain better. Using CT scan, functional MRI, microelectrodes, we have found out that mental and psychological stress is one of the major risk factors for hypertension. The reactivity of the cardiovascular system to psychological stress has been extensively associated with the development of arterial hypertension. The stress response implies activation of the sympathetic nervous system and the corresponding secretion of dangerous chemicals like adrenaline, norepinephrine. All of these increase blood pressure tremendously and can cause disastrous consequences like heart attack, stroke, a severe arrhythmia causing death. So it's very important to understand that mental and psychosocial factors is completely mediated by the brain, depend on what sort of environment you have kept yourself in, you've kept your mental condition in, and that is not can not only be the root cause of hypertension, but is also responsible for creating malignant hypertension and hypertension that is not responsive to treatment until you take care of those mental factors. We shall talk more about them. That's where I think yoga plays a massive role. Unlike modern medicine, we'll go through them step by step. So, as you know, stress causes activation of the sympathetic nervous system. Activation of the sympathetic nervous system increases heart rate, causes palpitation. If this is maintained over time, what happens is it causes hypertension, and hypertension itself really does a bunch of things. It causes atherosclerosis because there is inflammation in the blood vessels. So there is, which could lead to inflammation, blockages of the blood vessels responsible for ischemic heart disease, heart attack, and stroke, the other name of which is cerebrovascular accident. So stress plays a crucial role in not only initiating but also propagating pathophysiological changes in the blood vessels of the body, both in the heart, in the brain, the peripheral system of the body, which results in different diseases. Though the manifestation is different, the cause is one single. The manifestation could be a heart attack or a stroke or a peripheral artery disease, but the origin is from stress, and we'll talk more about that in the slides to come. So it's important to understand when you have a high blood pressure, the persistence of high blood pressure causes gradual adaptation of the arterial smooth muscle which lies surrounding your blood vessels. So when it gets adjusted to this, they become hypertrophied to manage this high blood pressure that you're having. And in the long run, this causes thickening. For example, the blood supply to the brain is through the carotid arteries. The walls get thickened. The walls that supply to the blood vessel that supply to your coronary arteries that supply to your heart get thickens. There is inflammation, and that can lead to blockages causing massive heart attacks or MI. And also there are release of a bunch of chemicals like renin, norepinephrine, cortisol, and all of these are related to the multiple pathophysiology that we see when we have hypertension and high blood pressure. So one of the important things that happens is when we have stress is the hypothalamic pituitary adrenal axis gets dysregulated. What does that mean? So chronic stimulation from this organ, which is the highest neuroendocrinal mechanism of the human body, it induces multiple pathophysiological response. First and foremost, it increases sympathetic drive. It causes heightened autonomic activities. It causes insulin resistance. It causes hypertension. As I've been telling, it causes exaggerated inflammatory response, platelet activation, endothelial dysfunction. And all this result in inflammation all over the body, resulting in heart attack, stroke, peripheral artery disease, all with dangerous manifestation. Now, it is important to understand that any psychosocial reason causes this problem, but some of the things which are extremely common include, like say, depression. A lot of people, millions of people suffer from mild depression and may not even know about it. But what is important to understand that mild depression actually results in dysregulation of the hypothalamic pituitary axis, resulting in hypercortisolemia, causing diminished feedback control, resulting in increase in atherosclerosis because it causes endothelial dysfunction, it causes platelet activation, it causes exaggerated inflammatory response. So, psychosocial factors like depression, anxiety, stress, they have a massive effect on the body, which was not quite known for the few thousands of years that modern medicine has progressed. But researches into the mind body connection in the last couple of decades had made this relation extremely clear. And we not only know the molecular and the cellular mechanism, we have even we even traced out the genes that are responsible for initiating and perpetuating this mayhem within the body, all starting from stress. So this is what the genes are. Is a bundle of genes called the CTRA. CTRA are a group of genes which gets activated when there is stress. Now, both acute and chronic stress cause activation of these bunch of genes called the CTRA. But the problem with CTRA is that what CTRA does, it increases the pro-inflammatory state of the body. So what essentially happens is when CTRA is activated, the blood vessel supplying to your body gets inflamed. When the blood vessels to the heart is inflamed, you get heart attack. When the blood vessels to the brain gets inflamed, you get stroke. When it blocks the blood vessels supporting your eyes, you can have retinal artery thrombosis. When it involves the blood vessel that goes to your legs, you can have peripheral artery disease, which will result in amputations and other problems. So CTRA is activated both in acute and chronic stress. But the good news is you need acute stress for different reasons. And even if CTRA is activated, it gets stopped the moment the acute need for CTRA is gone. But when you have chronic stress, CTRA is constantly activated and it remains activation and it continues to do it continues to support all the pathophysiology that results in severe inflammation all over the body, resulting in heart attack, diabetes, hypertension, stroke, and name it. All the mayhem that we know of that is perpetuated by CTRA gets amplified when you have chronic stress. And it's also important to understand that people have chronic stress when they may not actually be any threat. So this chronic stress is maladaptive. Or the other thing is, which basically means when you need stress, for example, you have an exam tomorrow, you have stress. That stress is good because you need that excess work that you need to do. You need to have a better memory so that your performance in the test gets better or your performance in the exam gets better. But after the exam is over, your stress should go away completely. So the activation of CTRA should stop. But in people who have chronic inflammation, it is found they have chronic stress. So the cause of stress is gone for long, but they continue to have stress, and that stress causes continuing activation of CTRA. Continuing activation of CTRA causes chronic inflammation that is associated with increased risk of certain cancers, certain degenerative diseases, neurodegenerative diseases, cardiovascular diseases, psychiatric illnesses, name it. It can cause a bunch of problems. It even unfortunately down regulates your immune system, rendering you susceptible to infections like COVID infection or other viral infection. So, CTRA unfortunately is one of those bad things that is extremely helpful when it is active and working for a very short time, like when you have an acute stress, but really becomes our enemy when it is led to stay for a long time. And that's exactly what happens when people have what is called chronic stress. So, how is yoga beneficial? The beneficial action of yoga in the prevention and management of arterial hypertension, in simple words, can be put in two main pathways. One is healthy behavior. Yoga induces healthy behavior. So, yoga practice is itself a physical activity and is based on maintaining healthy behavior, healthy habits, and lifestyle. Number two is stress management. Yoga involves a set of techniques, including pratyahara, dharana, dhyana, or concentration, mindfulness, and meditation that helps to cope with stress. And these are the two principal mechanisms why yoga is beneficial for people who have high blood pressure and have side effects or problems from high blood pressure, including those who have had heart attack, stroke, and other diseases. So, according to systemic review, there actually can be two pathways to summarize the role of yoga. One is that reduce the effect of stress and fosters multiple positive downstream effect on the neuroendocrine status, on the metabolic function, and thereafter causes a decrease in inflammatory modulators, as I spoke about, decrease in the sympathomimetic drive, and changing the HPA axis so that it is not misregulated, resulting in resulting in well-being, because any one or more of this, when they cluster together, as when people have stress, they result in massive systemic diseases, massive systemic inflammation, causing a bunch of disease which we spoke about. Now, could be another pathway that is involved, and that is what we know is it also enhances the parasympathetic drive. So when you stimulate the vagus, that itself causes a bunch of things. It sort of slows down your autonomic nervous system or changes the balance of your autonomic nervous system, so that the entire body is not in a form as if it is acutely going through massive stress. So the metabolic parameters, the inflammatory responses, that all we see with sympathetic discharge gets annulled or stopped or modified, so that the cardiac function gets better, flow of blood vessels get through the blood vessels get better, endothelium, which lines the blood vessel, which is prone to inflammation when we have sympathetic discharges, that gets better. So one of these two pathways or both these pathways may be working together when yoga works. But the question that remains is that what exactly does yoga does? We can only know that if we understand what stress responses causes. So first, as you can see, stress response causes autonomic dysfunction, which decreases heart rate variability. Decreasing heart rate variability, you can have cardiac electrical instability, which can cause death suddenly, that is called sudden cardiac death. Every 2 minutes, somebody or the other may be dying all over the world because of cardiac instability or sudden cardiac death. Number two is stress causes neuroendocrine activation. So there's increased level of cortisol and catecholamines. What does that do? That can result in different diseases, including heart attack, stroke. But there's another big thing that it does. What is that? It decreases your immunity. So your chance of having a viral infection, including COVID, is way increased if you're having stress-related neuroendocrine activation. The next is stress causes hemodynamic changes like increased blood pressure, increased heart rate, which, as you know, causes hypertension. And that also leads to heart attack, stroke. If you look at the pathophysiology, it causes what we call atherosclerotic plaque disruption. Or in simple word, that means the blood vessel supplying the heart, the blood vessel supplying the brain gets inflamed, resulting in heart attack and stroke. Then there is problem with coagulation also. The platelet activation is increased, fibrinogen levels are increased. There's increased viscosity of the blood. Again, this results in blood clot formation, which in medical term we call thrombus formation. And that thrombus formation again blocks the artery, blood vessels in the brain, in the heart, in the peripheral system, resulting in myocardial infarction, resulting in cerebrovascular accident, resulting in peripheral artery disease. Last but not the least, but one of the most dangerous consequence of stress is what is called cytokine levels, increased cytokine levels and increased levels of a bunch of other chemicals. So increased stress causes release of interleukin 6, interleukin 13. These are dangerous chemicals. Say, for example, COVID. 90% of people who died out of COVID has died because body produced that high level of interleukin 6 that caused massive destruction. It causes multi-system failure. It damages your lung, it damages the kidney, it damages the brain, it damages the heart, causes heart failure. So this massive increase in cytokine levels, which is known as cytokine storm, is initiated by stress response. And each and every of the response that I spoke to you about you that you can clearly see in this particular slide, each and every one of them is not only attenuated but also stopped when you practice yoga and continue practicing yoga for a long time. So for yoga in hypertension, these are the couple of mechanisms. So all aspects of human psychophysiological functioning is improved because, as you know, it's the psychophysiology like depression, anxiety, stress. They cause hypertension, leading to heart disease or brain disease and death. So those are taken care of when you practice yoga. When the breath is steady, emotion becomes more balanced. So you're not going into severe depression, you're not going into severe anxiety. Each of this causes release of interleukin 6 and other dangerous chemical that again leads to high blood pressure and even death, especially cardiac death. Certain type of breathing increase parasympathetic drive. We'll talk about a couple of breathing techniques that as a clinical therapist you need to know so that you can tell your patients or tell your friends and they can practice by themselves without going to a doctor, without spending a lot of money, being in a hospital. But same time staying at home, practicing them appropriately so that you can have a healthy life. Even if you have high blood pressure, even if you have diabetes mellitus, you can decrease your chance of getting heart attack, stroke, and other diseases by practicing these different yoga and pranayam or breathing techniques. And it's important to understand that conscious focus on the present moment induces less release of neurohormonal entities that induce vascular inflammation. So the vascular inflammation that I spoke to you about, including inflammation in your heart, inflammation in your brain, can actually be reduced because the chemical that actually cause them, for example, the sympathomimetic chemicals, the interleukin 6, interleukin 13, the TNF alpha, all this chemical release is completely attenuated to the extent that it may completely be stopped. And even the activation of the CTA-RA genes that we spoke about can be completely reverted when you practice yoga for a long time. And that's why long-term yoga practitioners are very healthy. The real practitioners, they have a healthy heart, healthy body, and even they may be aged like 70, 80, 90 years old, but they appear as healthy as a 50, 60-year-old man. So a lot of these is because the general destruction of the body that takes place because of stress is attenuated to a large extent when you go on practicing yoga. And that's a very important concept that modern medicine have come to understand after research in the last 20 to 30 years. So I'm now going to take you through some of the latest yoga research. This is the article that we were invited to publish in one of the world's topmost journal called the Journal of Integrative and Complementary Medicine. And feel free to take a look at this article. Basically, this article highlights some of the latest researches in hypertension, metabolic diseases, and how yoga helps. This is based on actual research in the last couple of years. So this is the latest research in the field of yoga and how it protects against large number of chronic diseases what we call non-infective diseases. So feel free to go through this article, which will give you a better understanding of how yoga scientifically works based on randomized clinical trials throughout the world. You get the real science as to how yoga works. So, the recent evidence of yoga for hypertension are many, and we'll talk about some of them. One is that a significant reduction in both systolic blood pressure and diastolic blood pressure is reported in people having yoga compared to those who have only standard medical care, and when people also have sham yoga. So what that means is if you're just having standard medical care, but along with standard medical care, you start having yoga, real yoga, you will find you have the significant reduction in blood pressure, both systolic as well as diastolic blood pressure. And in fact, that is important. If you are a clinician, if you are practicing, if you are a practitioner, it is important to tell your patients that they can take modern medicine, or if they're wishing to take modern medicine, that may be okay. But if they really want to prevent damage from hypertension, if they really want a longer disease free life, medicine itself is not enough. It is important to learn yoga, practice yoga, which includes asanas, which includes breathing techniques and mental techniques, so that you can have a better control on your blood pressure. Sometimes people may be on 2 or 3 medications and they're not getting controlled. And you add yoga to their regimen, they get controlled immediately. And in the long run, they can also decrease the number of medicine they are on. And this is proved by medical research. This is not something that we are something that is a daydreaming or a fantasy. This has actually been proved that long-term yoga practitioner can actually decrease the number of medications they need, say for example in hypertension. So let's go to the next step. There is the RCT, there is a randomized control trial which actually showed a type of breathing called Sitali Pranayam or cooling breathing. If people who practice this for 30 minutes daily for 4 weeks, and similar number of patients did something else, they found that the people who were practicing this breathing technique had significantly reduced blood pressure and had improved heart rate variability. That's very important to understand that because this is a technique that you can just learn and sit at home and do it at your leisure. You don't have to go to a doctor, you don't have to take any particular advice. Yes, you already have a disease, you have some other problem, you might need medical opinion if you can do this or not. But once you start doing it, it's very simple. It doesn't cost you anything. You can sit at home and doing it. And this is one research that clearly shows that this breathing technique has got a very powerful role in decreasing both systolic and diastolic blood pressure. Now, I've always asked this question, what sort of meditation, what sort of yoga is good? Because today you have hundreds of different yoga. So it's important to understand, though they come in different names, say Bikram Yoga, which is a type of Hatha Yoga, Kundalini Yoga, Sudarshan Kriya, but basically they are different names for more or less the same technique that we know from Patanjali Yoga Sutra for the last 10,000 years. So though they have different names, but in essence, they are either Hatha Yoga, which is physical exercises or asana, or the composite yoga, which includes the 8 steps of Patanjali. So it is important to understand whatever you do, more or less, almost every one of them gives you benefit. Benefit in certain cases may be more, in certain cases may be less, but that's not very significant. What is significant is yoga relieves psychological stress, and any one of the forms of yoga that is popularly known today can actually help you in that. Now, as I said, hypertension is important part of the metabolic syndrome, and metabolic syndrome itself can cause a bunch of diseases and diseases and deaths. As you know, heart disease is the number one cause of death in the world. Heart disease causes twice the number of death than the second largest cause of death, which is cancer. So every 2 minutes, somebody is dying because of heart disease. And this is a really bad situation. And this is true even after massive development in medicine, massive development in technology. Now we have stenting, we have treatments for heart failure. But despite that, the death has continued to increase and not decrease. And cardiac death remains the predominant cause of death in this planet. So it is important to understand that we need to bring in other things also other than modern medicine. And lifestyle is one of the most important things that we now know plays an important role in reducing cardiac death, cardiac mortality, cardiac morbidity. So, in this study, they tried to assess the impact of yoga based lifestyle, including diet, on cardiometabolic risk factors and continuous risk scores in people with metabolic disease. Most of the people who came in this trial was between 20 to 45 years of age, and they showed that there was a significant reduction in waist circumference, which you know is a risk for heart disease, triglyceride, again, which is a risk for heart attacks, high density lipoprotein, which is a very, very high risk. Low level of high density lipoprotein is a very, very high risk for heart disease. And as you know, there is almost no medicines that we know that really increases high density lipoprotein. So HDL is only increased by physical exercises, asanas, and appropriate diet. So that is a very important understanding that every practitioner must know, that if you think for everything there's a medicine and you can pick up a pill and pop a pill in your mouth, that thing gets cured. That's not true. There are a lot of diseases which are only taken care of if you do physical exercises like yoga. So in this study, they showed that high density lipoprotein got better, the diastolic blood pressure got better, fasting plasma glucose level got better, and macronutrient intake also got better. So the significant reduction in a bunch of things which actually is not treatable directly with medicines, but with lifestyle only, has shown to be improved in this study. And yoga, fortunately, is one of those powerful lifestyle things, which includes, of course, asanas, mindfulness, that is dharana, dhyana, that is meditation, and a lifestyle and yogic lifestyle plays a big role in controlling metabolic syndrome, which unfortunately is one of the largest killer in the world. So it's also important to understand that every aspect of yoga is important. It's not only the asanas, the meditation and a lot of other things play an important role. For example, in this study, it was clearly shown that you did not have to do asanas or physical postures, but just meditation, relaxation techniques was very important in lowering ambulatory systolic blood pressure than any other form. And it's being a practitioner, this is very important, that when you see a patient, it is important to understand what exactly you need to do. Some people might need more asanas, some people might need techniques for relaxation like meditation, mindfulness, dharana, dhyana, and all these things more than asanas to do. That's where medicine comes. Yoga is part and parcel of medicine. So it has to be treated like that. You have to have a good knowledge of medicine. Doesn't matter which pathy you are. You could be a naturopath, you could be a homeopath, you could be an Ayurveda specialist, or you could be an allopath. But yoga can be used scientifically for all the pathies to get a huge load of benefit that is not possible by any form of medicine directly, or any other form of treatment. So it's important to understand that the role yoga plays is fundamental to a lot of this disease process. Now, we want to talk about, as you know, yoga basically has 8 steps. So there are 3 important components in yoga. One is you practice asanas. Number 2 is you practice only breathing technique. And third is you practice meditation. So in one study, they took these 3 interventions separately to see which affected arterial hypertension or essential arterial hypertension. So, what it found was, although a clinical significant decrease in BP was found in all the yogic interventions, so whether you're doing pranayama, whether you're doing asanas, whether you're doing meditation or dhyana, there is decrease in systolic and diastolic blood pressure in every one of this. But the result also showed a differential effect of improvement in self-regulation and emotional symptomatology, as well as decrease in physiological parameters related to essential hypertension, specifically in the meditation intervention. That's very important, and I think by now that is very clear also that there are a lot of mental factors that is not treated when you practice asanas. Some of these mental factors are treated partially and the stress is reduced when you practice breathing. But almost all the mental factors, whether it is stress, whether it is anxiety, whether it is post traumatic stress disorder, whether it is depression, everything is reduced when you practice meditation. So, meditation, obviously, as this study shows, is one of the most powerful measure to not to reduce blood pressure, because other than the physical reason why blood pressure happens, as we explained till now, a large amount is psychosocial, that is coming directly from your brain, from your mind, from your emotional center. And unless we control that, it doesn't matter how many medicine you take, it doesn't matter what physical exercise you do, including just asana practice, nothing will be able to control your blood pressure completely. Nothing will be able to control all the risk factors, all the side effect, adverse effect of high blood pressure, including heart attack, stroke, peripheral artery disease, blindness, chronic kidney disease, and chronic kidney damage leading to dialysis. None of this will be controlled unless you practice all the three aspects of yoga, including asanas, pranayama or breathing techniques, as well as meditation. And all of them are equally important. So it's important to understand that with reduction in SNS activity, there's sympathetic downregulation. And sympathetic downregulation is very important because with sympathetic downregulation itself causes a massive fall in diastolic and systolic blood pressure. And more importantly, it causes increased heart rate variability, which, as you know, in the long run might protect you from getting sudden cardiac death, which is one of the commonest cause of death due to heart disease. People suddenly have their heart going fast and they die even before they can call in for an ambulance or a helicopter flies in to pick you up and take you to the hospital. Even before that happens, people are dead. And this can only be done when you practice yogic techniques that bring down sympathetic activities in the body. Now, yoga and stress reduction, we already spoke about this. This is another study which showed just 2 months of yoga training increases cardiovascular reactivity. Decreases cardiovascular reactivity to stress, whether the stress is induced by physical activity, whether it is induced by emotional activity like fear of COVID, lockdowns, emotional stress due to other cause like loss of a job, loss of a close relative, any number of things. But yoga helps in all those aspects. So I was part of the group from American Heart Association that brought about this practice guidelines that was used by people all over the world, multiple countries, multiple languages. This was transmitted to. Basically, this shows what role meditation plays in bringing down cardiovascular risk reduction. This is an important document because this is the first time in modern medicine, and one of the world's largest organization, which is an organization of cardiologists, cardiovascular surgeons, vascular specialists, all came together, and we brought out this document to show the world that meditation does play a discrete role in reducing cardiovascular risk, and it should be part and parcel of the treatment strategy. And again, it doesn't matter what treatment strategy you're using. If you're an allopathic doctor, you can use allopathic medicine. If you're a naturopathic doctor, you can use naturopathic herbs. But whatever you're using, it doesn't make any difference. But meditation and yoga should be part and parcel of your therapeutic armamentarium if you're really intending to decrease the side effect of drugs, if you're really intending to bring down the mortality and morbidity of cardiovascular disease. So, this is an important contribution to the literature that will make you understand what modern medicine also thinks the important role that meditation and yoga plays in reducing cardiovascular risk. So by now it is clear that mental makeup, including mental problems like depression, anxiety, stress, increases the chances of cardiovascular mortality. If a person has a heart attack today, and along with that, if he has depression, his chance of dying is twice than another person who has heart attack but does not have depression. So it is important to understand what a major role yoga plays both in curbing depression as well as in curbing the inflammation that depression can cause in the arteries, resulting in a massive heart attacks. So this is one study, one of the latest study that I picked up showing the effect of yoga on depression. In this particular study, they took ladies with significant depression, and they were, remember, it's not mild depression but significant depression, and they were divided into two groups. One got low dose of yoga, that is 30 minutes of yoga 2 to 3 times a week, and the second got 90 minutes of yoga 2 to 3 times a week. Both of the group were given the sessions for 3 months, and it was found that low dose yoga increased GABA, which decreased depression. So thus, based on this study, it is important to understand two facets. One is not only yoga takes care of depression, and as depression is controlled, the mortality from cardiovascular disease decreases, but the dosage of yoga is also important. And that's an important point that I want to highlight, that we have people who might be good yoga practitioners and they start giving other people advice about yoga. That is inappropriate. People giving medical advice about yoga should be trained physicians. It doesn't matter what pathy they belongs to. They can be allopathic, they can be naturopathic, but it is very, very important to understand that it should be a person who's well trained in medicine, understands yoga, and should give advice. So it is important to understand that yoga in medicine is a medical subject. It not only needs a thorough understanding of yoga, the physics, the medicine, the science, the biology of yoga, but also of medicine. Because if you're not cognizant with human anatomy, human pathology, then you cannot bring two things together. So just because you're a good yoga practitioner and you can stand on your head for half an hour does not make you a clinical yoga therapist. You must be a physician or have a solid knowledge of human physiology before you can actually be lay claim to be a clinical yoga therapist. So this study makes it amply clear that not only depression, but even severe depression can be treated using yoga. And so you can understand how powerful role yoga can play, not only changing the mental aberration, but also changing the inflammation that comes along with such mental aberration. So yoga plays a massive role in reducing a whole load of metabolic factors. As you know, metabolic syndrome is a load of condition where you find a bunch of problems coming together, and that increases mortality, morbidity, causes heart attack, causes stroke. Some people believe diabetes mellitus can or may increase some form of cancers, though that is not very clear. But yoga actually has been shown to reduce BMI, thus reducing your chance for having obesity, reducing your risk for diabetes, reducing your risk for having heart attack. It improves fasting glucose level. It improves HbA1c. It improves systolic blood pressure. It improves oxidative stress. It improves inflammatory markers, improves lipid profile, antioxidant levels, and sleep quality compared to the control group. This is a massive, powerful study that clearly delineates the powerful role yoga has in not only controlling hypertension, but a whole plethora of metabolic abnormality that results in heart diseases. Moreover, there's also a study that actually showed that yoga was associated with eightfold higher chance of attaining favorable composite ADS scores of 1 and 2. And that's not easy. As you know, we are coming to a place where we not only need good drugs for diabetes, and we have some of them, but this medication needs to be cardioprotective. Yoga is the one therapy that is not only extremely cardioprotective, but also helps in bringing down diabetes and hypertension, the two most common reasons why people have heart disease and die due to heart disease. Different breathing has been shown to have powerful effects on yoga, and we are going to just talk about some small basic stuff in this particular talk. So both pranayama, which is the yogic breathing technique, has been clearly shown to increase heart rate variability, that is HRV, and also decrease blood pressure. As you know, long-term increase in heart rate variability makes you have a most robust cardiovascular system, whereas a poor heart rate variability can cause what is called arrhythmias and sudden cardiac death. So it's very important that we understand the crucial role yoga plays, not only in controlling hypertension, but going way beyond in also improving the heart rate variability. Now we'll talk about some of the breathing techniques very briefly based because of this talk and time limitations. One is Anuloma Viloma, which is alternate nostril breathing. Second is Surya Pranayama, which is breathing from the right nostrils. And the third is Chandra Pranayama, that is breathing through the left nostrils. Now, breathing has got multiple effects. Right nostril breathing causes an increase in sympathetic drive, whereas Anuloma Viloma, that is alternate nostril breathing, and Chandrabheda Pranayam, which is the left nostril breathing, actually decreases systolic blood pressure, decreases diastolic blood pressure, and also have a role in improving heart rate variability in the long run. So it is important to learn and know this breathing technique. Again, I want to interject here to say this cannot be done just by a yoga practitioner. This should be done by a person understanding or trained in medicine, either a physician or a yoga practitioner that has actually done course in clinical yoga therapy. So they understand what each breathing means, what is the psychological impact of this breathing, what is the physiological impact of this breathing, who are the patients who can do this breathing and who cannot, because in them the risk is more than the benefit. So with that, it is important for us to know how different breathing techniques can actually help you not only in preventing heart disease, but if you already have heart disease, it can prevent you from having recurrent problems like recurrent heart attacks, constantly increasing blood pressure, requiring multiple drugs, poor HRV, which causes sudden cardiac death, and such other problems. So we have a couple of pranayama, like Shitali pranayama, as I said, has been proved to decrease systolic and diastolic blood pressure. Then we have the Brahmari pranayama, which is a yogic breathing technique in the sound of a bumblebee. This has been found to increase HRV. So unless you are a trained physician who understands the meaning of these terms, it is impossible for you to make use or treat your patients. So it is very important that all of us who are practicing and teaching patients these techniques must have appropriate training in clinical yoga therapy so that they can appropriately prescribe and patients can take benefit of these breathing techniques, which doesn't cause extra money. Patients do not have to go to any medical facility or hospital. They can sit in their home at their own time and practice this breathing and get the benefit from them. But yes, certain patients cannot, like severe heart failure and a couple of other conditions, people with unstable arrhythmias. But in that, and that is the reason why anybody who can do yoga is not a person who can actually teach clinical yoga therapy. You have to be a trained person to be able to teach clinical yoga therapy. This is an important document from the Cochrane, which clearly says in mild hypertension, patients can be actually put on yoga, and yoga might actually help them even staying without medications. Plus, it also says that total mortality of people who actually were with antihypertensive drug when compared to those without antihypertensive drug did not have any difference in mortality. So let's understand this clearly. Our understanding is in mild hypertension, when we give people a couple of medications to control their blood pressure, their mortality decreases. It actually does not. Whereas yoga has been clearly shown to decrease mortality in patients with hypertension who are on multiple drugs. Albeit there is some controversy on that because some studies have shown, some studies have not shown. Some studies are powerful enough to show, some studies are not powerful enough to show. But the overall benefit of yoga cannot be discounted. This is a recent meta-analysis carried out by Chadda, which showed that slow breathing helps in reducing blood pressure. The authors concluded that for people with low-risk hypertension, it is important that they can just be on yoga and diet control rather than having to be started on medicines because these control blood pressure very well. In case they fail to control blood pressure, then it is appropriate to start them on medicines. In modern clinical practice also, that is the rule. Anybody comes to with pre-hypertension, it is appropriate not to start them on a medicine but institute lifestyle changes like appropriate diet with low salts, a lot of fruits and vegetables, lifestyle changes like starting exercises, and then they can starting meditation, mindfulness to reduce stress. They can do this for a span of 3 months, and if that controls their blood pressure very well, they do not need to be started on any medications. But if that is not controlled, then you start them on medications. This is quite contrary to what is seen. Every time you go to a physician, the first thing they do is give you a medicine, then give you advice about lifestyle changes. That should not be the path. The path should be you should ask your patient first to undergo lifestyle changes, make them understand the tremendous role these play. Medications are important, but they're only important when after having lifestyle changes, it has not changed and your blood pressure continues to remain high in prehypertensive patients. So yoga saves cost. Millions of dollars are spent, billions of dollars are spent all over the world, including in poor countries which cannot afford to do that to save from hypertension and its consequences like heart attack, stroke, coronary artery disease, peripheral artery disease. And as you know, even some of the rich countries like the United States of America, the health system is ultimately going to break down given the massive expenditure on public health. So it is important that we popularize yogic therapy so that people can remain healthy by their own doings, which includes changing lifestyle, doing yoga asanas, and practicing mindfulness and meditation, that is dharana and dhyana, rather than depending on medicines to control their disease and control their illness. This will give you a picture of how much it costs for just blood pressure. It's almost around $80 billion. But remember, this is just for high pressure. High blood pressure is just the tip of the iceberg. High blood pressure leads to a whole plethora of diseases. And if you take all of them together, it costs trillions of dollars every year. But this cost can be negated and if you practice lifestyle changes and regular yoga. And it's also important to understand that this is not only in rich countries or the Western nations, even in poor, underdeveloped nations like Africa, Middle East, you can have the same problem. So, what is more important is that it doesn't matter because hypertension affects every color, every creed, every race, every caste. So, it is not important for one person versus other. It is universally important that cardiovascular disease, hypertension, these are massively recurring costing for any nation, any person, any family, any society. And the best way to treat them is not just using modern medicine and drugs, but also bringing in lifestyle changes. We are coming out with what is the world's first book on the effect of yoga and cardiovascular disease. It is written by over 75 authors from world's top universities, including Harvard, Emory, and top medical colleges also in India, like All India Institute of Medical Sciences, New Delhi, PGI Chandigarh. Um, so this book will elaborate the role of yoga in every heart disease, including hypertension. It has got special chapters on how yoga can help in hypertension. It also has special chapters on how meditation can help in hypertension. And these chapters are written by world number one authorities on these diseases and yoga. So this book will be out within a month. If you can lay your hands on this, that will help you as a textbook to learn the role yoga plays in cardiovascular diseases. We in American Academy of Yoga and Meditation believe in yoga, clinical yoga therapy should be given by people who are trained and certified. Just because somebody can stand on their head for 30 minutes or can do Brahmari Pranayam better than you and me, he doesn't become a clinical yoga therapist. So, to be a clinical yoga therapist, you need to have basic education, you need to have a knowledge of medicine, you need to have a knowledge of physiology, pathophysiology of diseases, and also you need to have a solid understanding of the medical benefits of yoga, the pathophysiology of diseases, and how yoga works at every level, the cell level, the molecular level, the genetic level, and the level of the human body and such. So we provide courses with certification by both us as well as from the only yoga university outside India, that is Vayu. So you will get an American certificate for doing that. This could be done at a personal level. We are also doing this for different universities in different countries, whereby their students can take this course, and along with the certificate provided by those institutions, we provide certification from us and by you, so that people can start practicing yoga. So what is the difference between us and other people? The first thing is all our physicians who are taking these courses are trained medicine people, are trained doctors from America. So all over the world, they are recognized as physician trained in America. Then they have got extensive training in yoga, who understands the pathophysiology of yoga, the medical benefits of yoga, and are updated with the latest science. Yoga is a science that is getting updated every day, though it is 10,000 years old practice, but the medicine of yoga is getting updated every day by some of the world's topmost scientists working to find out how yoga works. So these courses are tailored for that. Anybody who takes these courses, they are very simple, but they're done by real authorities who are actually trained both in modern medicine and yoga, so that these are integrative practices that any student of medicine, whether it is allopathic, homeopathic, Ayurveda, or naturopathic, they can learn and can practice this in their own practice. This will not only enable physicians to get a wider armamentarium of treatment for their patients, but also help the patient to take benefit of this 10,000 years old philosophy when it is appropriately done by learned people. So in conclusion, yoga and meditation provides a cost-effective and effective way of managing non-communicable diseases, including hypertension, either isolated or in combination with modern conventional therapy. As I said, that conventional therapy can be allopathic, homeopathic, Ayurveda, or naturopathy. However, the efficacy of various intervention needs to be studied, and that is something that you as a physician, you as a yoga practitioner can yourself do in your own practice. When you have patients of different diseases who come to you, you give them yoga protocols, and you can try out different yoga protocols and see what is the best for your patients. That is how modern medicine moves. That is how we do it in allopathic medicine also. So with that, I will end today. If you have any questions, do not hesitate to contact us. Our number and our email is given below. Thank you very much. Hello, everybody. Thank you very much for having me. Today, we are going to talk